Good afternoon and hello. My name is Renee D. Waring, and I am the founder of Uniquely and Wonderfully Made Ministries. The title of my talk today is Influenza 1918 Mental Illness Part 1 R period capital WARRING. My presentations can be found on the following social media sites: on LinkedIn under Renee D. Waring, on Facebook under Waring Communications LLC, on Twitter under @Renee Waring, and on YouTube under WARRING. In 1918, avian influenza epidemic lasted for several months, which reduced the average lifespan by 10 years. Since then, other pandemics have occurred, such as SARS and coronaviruses. Today, not only do the frontline workers have to deal with physical ramifications of the virus, but they must also deal with the psychiatric ramifications. The mental health casualties among survivors of the pandemic are intrinsic to natural disasters. Women, the elderly, those with pre-morbid psychopathology, which means preceding the occurrence of the symptoms of mental illness, and high direct and indirect trauma exposure, and those with poor social supports and low socioeconomic and educational backgrounds have the highest risk of traumatic reactions to the flu epidemic. We have no data available concerning the psychiatric ramifications of the 1918 influenza epidemic. There is some data available on the psychiatric disorders that was manifested in the SARS epidemic, which stands for Severe Acute Respiratory Syndrome. SARS, like the avian influenza outbreak of 1918, rose from an animal virus that mutated to a human-to-human transmittable form. Dr. Harilark and colleagues examined the psychological effects of 129 patients quarantined during the SARS epidemic and found that 28.9% met the criteria for post-traumatic stress disorder, or PTSD, and 31.2% for clinical depression. Dr. Stryer found out that 124 hospital SARS patients found out that out of 124 hospital SARS patients, 35% had clinical depression and 47% had the symptoms of PTSD 3 months after discharge. Among those afflicted, there was a high rate of failure to do work and to carry out daily responsibilities at home. Significant psychological distress was observed among physicians who provided care for the SARS patients. The occurrences of mental illness amongst the physicians who supplied care was 45% compared to 17.5% of physicians who did not provide care. The reasons why the percentage was higher amongst the physicians who provided care was because of the necessity of wearing protective R93 inhalers for protracted periods, the exposure to morbidity, which is the condition of being diseased, and mortality of co-workers, and the fear of infecting family members. The CDC, or Center for Disease Control, has developed software called the Flu Surge 2.0 to estimate the number of hospital admissions and deaths that will occur during the future avian flu pandemic. This, along with the SARS psychiatric data, may help to predict the magnitude of psychiatric surge in the next pandemic. On the basis of a U.S. population of 301 140,000 and 950,000 hospital beds, an attack rate of 35%, and a duration of 12 weeks. The Flu Surge 2.0 predicts that 1,396,768 new hospital admissions. Many of these patients will have significant psychiatric comorbidity, which is the simultaneous presence of two chronic diseases or conditions in a patient. Under normal circumstances, there is a 25% rate of mental illness in patients for a medical indication. In contrast, there were a mean rate of 36% of patients with SARS. In other words, out of a total of 301,140,000 admissions, 349,192 to 502,829 patients have the significance of mental illness during the pandemic. Thus ends my presentation for today. My video will air on the second week of next month on a Thursday or Friday. My presentations can be viewed on LinkedIn under Renee D. Waring, on Facebook under Waring Communications, LLC, on Twitter under @Renee Waring, and on YouTube under smallcase r smallcase Warring. I am the founder of Uniquely and Wonderfully Made Ministries. My name is Renee D. Waring, and I am the Warrior Warring.